So now we're going to review some case studies that has to do with lung assessment findings. So the case study number one, and first of all I want to say pause this video if you need to stop at any time because I kind of want to play along so that you can pick your answer before this slide comes up. So in case study number one, the situation is CQ is a 40-year-old female who presents to the emergency department with complaints of shortness of breath. She's accompanied by her daughter, and the daughter states she was starting to get concerned when she was unable to get through a sentence without coughing. It's a common presentation to the emergency room. A lot of people come in with just this vague complaint of shortness of breath. Background information, CQ says that she smokes a half a pack of cigarettes per day. The patient denies any sputum and nothing's present upon assessment. The patient states she does not exercise regularly and denies a history of asthma, but says most of the females in her family have asthma. Assessment, her respiratory rate is 30. Pulse ox is 90% on room air. Patient is sitting up to breathe using accessory muscles, and there's a high-pitched sound coming from both sides of her lungs. Let's listen. All right, so let's start with the questions. What is a normal respiratory rate? And here's the answer. The answer is 12 to 18 in adults, respirations per minute. Next question regarding this case study. What other information would you want to gather from CQ's background? Can you think of anything that you would ask her to clarify? One thing I would ask is how long has she smoked to determine the actual pack years. Remember, you take the number of, so if let's say she smoked a pack a day for 5 years, that would be 5 pack years. 2 packs a day for 5 years would be 10 pack years. And also want to know what activity she was doing when she became short of breath. So based on your assessment, what type of adventitious sounds are we hearing here? The answer is wheezing. And what kind of diagnosis do you anticipate for CQ? Asthma. So she has a family history of asthma. The wheezing sound and the shortness of breath that she's experiencing could all point to asthma. Number two, the situation, a mother presents to the doctor's office with her 2-year-old son, TC. She states that he has been having a hoarse voice with a cough that gets worse at night for the past 3 nights. She checked his temperature before bed last night and said it was 38.6. She gave him children's Tylenol. Very common type of scenario that could occur in a pediatrician's office. Background, mom states that TC is a happy and healthy boy, does not have any medical conditions, and his older sister has never had any of these symptoms. Some assessment, TC has a slight hoarseness in his voice. He has not coughed since presenting to the office. His respiratory rate is 22, temp 37.4, heart rate 110. He appears tired and flushed. Let's listen to his lungs. Identify the lung sound there. And that would be stridor. Remember, it's at a high-pitched sound that almost sounds like an obstruction. What can you anticipate as the diagnosis for TC? Key points to think about, to give you a little hint, would be it gets worse at night. And this would be croup. Now, when it comes to a parent bringing in her child, education is really big as far as giving the parent some advice. What would we want to say? And the biggest thing is parents must be educated to be aware of worsening condition or respiratory distress. The condition might only last a few days, but they should definitely take their child to the emergency room if acute or sudden onset of respiratory distress is present. So you're going to need to make sure the mom is well aware of what's normal and what's abnormal and when to notice that it's getting worse. So anything else you want to post about this case study, there's a link on the discussion board. Anything, stories you have in the past or just tips and tricks you want to add to your peers would be great.